I guess the biggest question, and I took some notes on the rates in the GTA as a whole. It seems like while the rest of the province in the last year that these numbers were available, most of the province seems to be in the 70s or 80s, whereas the GTA is in the low to high 30s. As a pediatrician, what is your general reaction to these numbers?
I am concerned to see that less kids are fully vaccinated for measles, as we know that if we don't have enough people getting both measles vaccines, the risk of measles coming out in the population is higher. We need to have at least 70, 80% of kids vaccinated for this illness to keep the numbers at bay. As soon as percentages of vaccine rates dip below that, we're at risk of seeing these illnesses come back again, which had been all but eradicated in Canada in the last number of decades.
And I guess it sort of touches on this in the report itself, as to why, maybe the numbers are as low as they are, some of which is credited to, in-person appointments not being as readily available during COVID and the safety precautions that came with that. What's your gut feeling as to why the numbers are so low in the GTA compared to the rest of Ontario?
I'm not really sure why in the GTA in particular it's lower. Certainly, many of us, particularly here at Kid Crew, we've been very much obsessed with making sure that we can continue to see our babies and children throughout the pandemic and ongoingly since then to make sure that they are up to date for all those important vaccines. But some people haven't had as much access to their clinicians over the last couple of years. We have a lot of issues in terms of physicians retiring or not being as accessible anymore. That's an Ontario-wide problem and really across Canada problem as well. Many people can't access their clinicians in a timely way. And of course, there's still some hesitance around seeing a doctor, even in these times when people are less concerned around COVID. But certainly, there's still lots of viruses going around, and some families may be hesitant to go to a doctor's office to risk being exposed to these illnesses. Also, though, I've noticed increased hesitancy around vaccines in general. Here at Kid Crew, our vaccine rates are very, very high. We've done a great job, and our patients trust us and continue to get the vaccines by and large. But I have had increasing voiced concern by parents about the safety of these vaccines, how long they've been used for and tested for. I think when a new vaccine comes out, like the COVID vaccine, it brings up a lot of questions around how vaccines are made and how are they tested and short-term and long-term side effects. And I think these are important conversations to have. I welcome these conversations with my patients because I want them to be informed about why they're getting vaccines and what are the potential risks of them, but also the benefits. Why do we give the measles vaccine? Why do we recommend the flu vaccine, et cetera? These are important conversations to have.
Yeah, and I'm glad you touched on vaccine hesitancy because it's not so much touched upon in this report, but I know, as you said, it is something that has been a topic of conversation in the last few years. I guess you sort of touched on this at the beginning, doctor, but what is the risk if, I think you said if we fall below 70, there's a risk. In this case, in some parts of the GTA, we're nearing 30%. What's the risk here if those numbers stay where they are or potentially go even lower?
If many people in a community are not vaccinated for a particular illness, one person gets it, let's say one person gets measles, other people that are not fully vaccinated, that are not immune to that illness, can get that illness. And if the next person, their neighbor, their schoolmate, their playmate isn't vaccinated, same idea, they can get that illness too. Now, by and large, measles is a pretty benign illness for most people. However, if you have enough people that get it, just like COVID, just like flu, just like other illnesses, there are risks, and some kids do get very, very sick, and some kids can die from measles. So the reason why we vaccinate for these, generally speaking, not very serious illnesses is because on a population basis, if enough people get it, you'll have a certain percentage that do get very sick, require hospitalization, or can even die from it. So that's why it's important to keep our vaccine rates high so that even if there is, let's say, one case, that it doesn't spread around really quickly because the vast majority of the population is vaccinated and immune. Even better if most people are vaccinated and immune, and then we won't even have any cases at all.
I know, kids and families are just getting back from March break. So maybe we haven't seen the full impact of that yet and travel related things that come with, coming back from places on vacation. Looking ahead to the summer, what should we be doing now at a population level to prevent both our vaccination rates going lower, but also more cases of measles popping up in the next few weeks and months?
I think it's definitely a priority to make sure that kids are seeing their primary care provider, be it a family doctor or pediatrician, to review what vaccines may be required, what vaccines are their kids missing, and catch them up. Because we know we need a couple weeks after a vaccine to really reach good immunity from that vaccine. In some cases, if kids have never had any measles vaccine, they definitely want to get the first and potentially the second one, a few months later to make sure they're fully immune. I think it's a good time to touch base with your healthcare provider and see where your child's at with their vaccine. And also, if you have not been there for a while, touch base with them, get measurements, do a blood pressure, have them examined, because lots of things we catch when kids are pretty well that could be something that becomes a problem later on. It really is important to follow up with your healthcare provider regularly.